Women who've undergone chemotherapy and radiation after breast cancer often have new challenges to face. Memory loss and mood change are commonly reported side effects of the treatments, but they're getting help from a non-invasive technique targeting the brain and central nervous system. Welcome Dr. Myra Preston with Cyber Imaging. Dr. Preston, thank you so much for being here today. Talk about the effects that chemotherapy and radiation can have on many women.
Well, the most important studies have been done on stage 1 and stage 2 breast cancer patients aging from 24 to 58, and pre and post comprehensive neuropsychiatric testing indicated that there was an overall decline by 11% of cognitive function. It appeared that age was not a factor. The primary factor in moderate to severe loss of function was the time in chemotherapy.
I know that from a lot of women I've spoken to over the years who've gone through this, say they just don't feel like themselves. They think they sort of feel the way they've described it to me as if they're losing their minds. That's a common thing.
That is a very common thing, and the primary decline is in short-term memory, visual memory, speed of processing, even to sit and enjoy reading a novel, and then sleep disturbance.
Some women, too, also report a change in sexual function.
Sexual function, which seems to be related to hormonal changes, but also when you have these toxic agents in the brain, it so decreases your brain function that it puts you into a state of chronic fatigue.
You talk about all these things and these things that can happen after a woman goes through a very difficult time in her life. Can these things be reversed?
Because we are talking about the function and not the structure of the brain, yes, these can be reversed. When we measure the function of the brain, we're measuring the ratios of the electrical activity, which are termed brain waves. We know by normative databases, age and gender matched, the ratio of the various brain waves that should be present in the brain and in the proper regions of the brain. Therefore, we are able to train or exercise that individual's brain towards a near normal or normal brainwave pattern.
Okay, it's neurotherapy. Can you talk a little bit about how it works?
The way neurotherapy works, it's a very sophisticated form of biofeedback. We measure the brain waves from the individual. Once we have determined the regions of the brain that have been affected by the chemotherapy, and we determine the ratio of abnormality in that individual's brain and develop a specific exercise program to restore that individual's brain to normal function via feeding back to that individual their brain waves in an immediate fashion and training and teaching that individual to exercise control over their own brain function and restoring it to normalcy by changing the physiology.
Interesting what you can do. To learn more about this, visit cyberimaging.com. It's S-I-B-E-R, cyberimaging.com. Again, S-I-B-E-R. You can also call 704-543-0427. Again, 704-543-0427. Dr. Preston, thank you so much.
Thank you.
Thanks for being here today.